Introducing the triple renal pelvis, or triplex collecting system, a rare and fascinating anatomical
variant of the renal
collecting system. This unique anomaly consists
of 3 distinct renal
pelves within one kidney,
with each pelvis responsible
for draining a separate section of the kidney.
What's more, each pelvis typically
Has its own ureter, resulting in a total of 3
ureters on the affected side.
Now let's delve into the key features of this intriguing
Condition. First, we explore the anatomy.
In a typical kidney, the renal pelvis collects urine from the calyces and funnels it into a single ureter. However, in the case of a triple renal pelvis, there are 3 separate pelves, each draining a different segment of the kidney. It's important to note that, while each pelvis usually connects
to its own ureter,
variations such as partial fusion of ureters or abnormal connections can occur.
when it comes to imaging,
Ultrasound may show an unusually complex,
or duplicated collecting system,
although it might not clearly differentiate, the 3 separate pelves of.
the triplex collecting system,
For a more accurate visualization,
CT urography or intravenous pyelogram.
IVP are the preferred modalities. These contrast studies highlight the individual drainage patterns of the 3 pelves and ureters. Additionally, MR urography can effectively demonstrate the presence of 3 separate renal pelves and their associated ureters. Moving on to clinical significance, a triple renal pelvis is typically asymptomatic and often discovered incidentally. However, it may be associated with complications. For example, vesicoureteral reflux, VUR, recurrent urinary tract infections, UTIs, tidal stone formation can occur due to the altered flow dynamics and potential urinary stasis caused by this anomaly. Now let's explore the surgical considerations. The presence of 3 renal pelves and ureters can complicate any surgical intervention on the kidney, such as pyeloplasty or stone removal. Therefore, detailed preoperative imaging is essential to plan the approach, ensuring the avoidance of potential damage to the collecting
System during procedures.
Finally, we consider the differential diagnosis. It's important to differentiate
A triple renal pelvis.
from other conditions. One such condition is the duplex collecting system, which consists of 2 pelves with either 2 separate ureters, complete duplex, or 2 ureters partially fused, incomplete duplex. Another condition to be aware of is the trifid renal pelvis, which is different from the triple renal pelvis. Trifid renal pelvis involves 3 infundibula merging into a single pelvis, rather than 3 separate pelves. In conclusion, the triple renal pelvis or triplex
Collecting system.
is a rare and complex anomaly. Although often benign,
It can present unique challenges in the diagnosis
and management of associated conditions. It is crucial to fully understand this anomaly, especially when considering surgical interventions or when planning preoperative imaging.